It's nice to see you.
Hi, good to see you.
Okay, we're going to take some questions from our audience here in a second on Facebook, but I wanted to give, if you can sort of paint the picture. I know you're at Fair Park right now, where we have sort of two side-by-side operations going on. Can you tell us what's going on at Fair Park right now?
Sure. Finishing up a day's worth of vaccinations. We had the FEMA team was doing the first dose of Pfizer, and then we're all working together also on some of the second doses for Moderna, trying to catch up due to the weather.
So what is the advice at the moment for people who are eligible? We can talk about people who aren't quite eligible or are concerned about maybe if they are or not, but what's the advice for people who are eligible in order to get themselves to this site or others?
So, we've been sending out invitations for people who've been on the waiting list in the 17 priority zip codes for the FEMA sites. So these are some of the highest vulnerability areas, these 17 zip codes. And, people need to be on the registration list. So register off of the county website. I think we have over 650,000 people signed up, but we're drawing from that and pulling the people from these zip codes for the first dose Pfizer. For the second dose of the Moderna, so we got a little, the weather messed up some of the schedules. Today, we were seeing persons who were due for their second dose on February 16th or earlier. Tomorrow, we're seeing persons who are due for their second dose on February 18th or earlier. And, we've been asking people to try to arrive about the same time of day that they got their first shot.
Why is that?
That's just to space out the people so everyone doesn't come at the same time. And everyone who received their first shot at Fair Park received a card that said what day to come back. And so those that for tomorrow that had a card that said come back on February 18th or sometime earlier can come back tomorrow. Friday, we're looking at if they were due to come back February 22nd or earlier. and again, to try to come around the same time of day that they got their first shot.
Can you give us a sense of how large the operation is there? I know you've called for volunteers. I know people who have volunteered. What's going on out there in terms of scope and scale?
So today, thus far, and we're still finishing up, we've seen 6,230 people through the drive-through. So we're getting a lot of people through. I think 1 hour we saw 845 people going through in 1 hour. So there's a lot of capacity here to see a lot of people, and it's a really nice partnership with FEMA people, and also, we have, as you mentioned, have a lot of volunteers that are working with us to get this done.
Becky Haley Gatlin says, if you have had the virus, you have to wait. How many days do you have to wait before you can get the vaccine, essentially? That's what Becky wants to know.
Well, one thing about which is like 10 days from onset of symptoms.
I'm going to have you start again.
If you're start again,
you froze up there for a little bit. How long do you have to wait if you've had the virus to get?
So if you've had the virus, I mean, if you currently have it, then we don't want you to come in while you're infectious. So we want to make sure that you no longer need to be isolated. So that would be like at least 10 days after the onset of symptoms, if your symptoms then have resolved. But then if say you had the virus, months ago, we know that we anticipate that you would have about 60 days of protection from the virus, or actually 90 days of protection. So you can wait that time, or you can go ahead and get the vaccine as long as you're not currently infected.
Matthew Gillespie says, no shot for me. There hasn't been time for clinical trials, and I didn't sign up to be a part of one.
I'm sorry, say that again?
I guess just Matthew Gillespie's sentiment is no shot for me. There hasn't been enough time for clinical trials.
Okay.
Yeah, how do you respond to it? I guess he's talking about the safety of the vaccines, and how can you make sure that if you're skeptical in some way, that this is something that's safe to do.
Yeah, the data has been reviewed, the clinical trials, the results were submitted to FDA and reviewed by CDC. These are really showing and proving to be very effective and quite safe. So these are really, it's an amazing scientific achievement, these vaccines.
Margaret Eldridge says, how do I reschedule first shot to a walk-up center? I'm assuming maybe she had something scheduled last week and couldn't make it because there was so much going on. How do you reschedule that first shot?
Let's see. So if it depends on where, if she's saying she got her appointment or invitation at Fair Park, that would be one thing. And so we're, going back over the lists of people who we invited. Actually, if she did receive an invitation, she may try to click on that link again and see if there are any new appointments available. Otherwise, we are going back through the people who registered who may not have gotten a vaccine, and we'll send out additional appointment invitations as they're available. We're also partnering with other partners, Methodist Hospital, Parkland Hospital, UT Southwestern, Grand Prairie, that we're sharing that the waiting list with some of those other groups. You might, in the city of Dallas, actually, pending availability of vaccine, you might get an invitation from one of those places also to get a vaccine.
We did a story earlier this evening that CVS now is also offering more vaccination sites as well. Do you interact with them?
We certainly meet weekly with all of the partners in Dallas County that are working on vaccinations. I think they have their own appointment system, so you can check with them and see how to make an appointment with the CVS sites. This
may be a very specific question from Steve Johnson. I have neighbors who are in their 80s. It has been over 4 weeks since they got their first shot at Fair Park. They went back to get the second shot, and after waiting several hours, were turned away. Is somebody going to call them? What happens if you go there and you don't execute whatever you meant to do to get your shot?
Yeah, as I said, again, the weather has been through another wrench at an already complicated situation.
Yeah.
So we are trying to catch up. And, we can't get everyone who was, due during that weather week all at the same time. So as I mentioned, today we were seeing people who were due for their second shot February 16th or before. Tomorrow, if you were due for your second dose on February 18th, or before, come on in. We're going from 8 a.m. till 5 p.m. and try to come in around the same time of day that you got your first shot. On Friday, we're seeing people who were due for their second dose on February 22nd or before. And again, we'll be in there from 8 a.m. to 5 p.m.
What about the people who are scheduled perhaps for next week? Becky Dickens says we are due for a second shot on Monday. Is it okay still to come to Fair Park on Monday?
Next Monday, we're looking at persons who were due February 24th or earlier.
Okay, so
and then so we're.
If she was scheduled, if she says she's scheduled for Monday, she's now delayed a week. Is that what that means?
Actually, Tuesday we're hoping to get the people who are due Monday, so we're almost caught up. And by Tuesday it should be the people who are due their second dose on March 1st or earlier, which was Monday. So we'd only be one day late.
This is maybe a similar question we were asking before, but what is in the vaccine?
So it's actually mRNA, the messenger RNA it's injected into, it's surrounded by a lipid to sort of protect it. And the body, then it sort of tricks the body into producing that protein from the COVID, the spike protein from COVID, tricks the body to produce that and then develop an immune response to that.
A couple people have asked. Oh, sorry. Go ahead.
No, again, I mean, it's really an amazing scientific achievement what they've done with this vaccine.
It absolutely is. Dr. Huang, we have a question. A couple people asked, why are you wearing a mask if you're sitting by yourself?
I'm actually in our FEMA site. So there are some other people in here. And so that's why I'm wearing the mask.
And I see you notice you're wearing a double mask. Is that sort of state of the art? That's what we should be doing now?
That's, some of the recommendations. It certainly makes sense, given some of the variants that are out there also that may be more easily transmitted. It's certainly many are recommending that.
Ellen Shaughnessy says, what markers will indicate that we're in the clear and can start getting back to quote unquote normal? What would be some of the milestones that we would need to see in order to say, okay, this is, we're trying, continuing to move in the right direction? What are those things that you look for?
Sure. Well, from the start, we've been monitoring a lot of different indicators, whether it's the number of new cases, whether it's the number of people visiting the emergency rooms for symptoms like COVID, whether it's the number of people being admitted to the hospital, whether it's the number of people that are in the hospital or in the ICUs, and then the number of deaths, as well as other indicators, some of the percent of the positive of tests. And so we watch all of those. We've been, fortunately, we have seen some declines over the last several weeks in a lot of the hospital indicators. But one of the messages still, we want to make clear that it's not, these are all good, these are encouraging, but it doesn't mean that we can relax yet. We still need to keep wearing the masks, still trying to avoid crowds, still keep the 6-foot physical distancing, but they're good signs. The other thing is we're monitoring, how many people are getting vaccinated, and all of those indicators are some of the things that we're following.
Does the vaccination rate, is that impacting the downward nature of the curve?
We're thinking that, there's some early signs certainly of that. We've heard, the hospital workers and healthcare workers were some of the first that received the vaccine. And we've heard from many of the hospitals and hospital systems that they've seen decreases in the absenteeism, the illness, the people, of the hospital workers. So some early indications and some thoughts that some of the declines, the slowing of the spread that we're seeing in our community are certainly related to the vaccines. I mean, we have now, getting close to, I think, over 400,000 persons in Dallas County have
Oh, wow.
received vaccine.
It's a lot.
So we're starting to make a real impact in the population.
I'm David Schechter. I'm with Dr. Philip Huang, who's the Director of Dallas County Health and Human Services, and we're taking your questions for another few minutes about essentially vaccinations and the vaccination process here. I'm seeing a message from Deborah Brown Green. She says, if you've ever been to Parkland, you can set up a Parkland My Chart and they will send you an appointment. Can you make your COVID vaccine appointment through the My Chart at Parkland?
My understanding with Parkland, if you're an existing Parkland patient, I'm not sure exactly how their mechanism works, if they're sending out invitations to persons who meet the 1A or 1B categories. That was how I thought they're doing it, but I haven't heard lately. But again, my understanding is that it's for existing Parkland patients who have that My Chart.
Okay. Another question, several questions about teachers. Rachel Kowalski, when will teachers be vaccinated? I know that we don't know the answer to that yet, but what's the thinking around teachers? They're really starting to get a lot more momentum behind that, it feels like.
Sure. Well, I mean, we want everyone to get vaccinated as quickly as possible. Unfortunately, there's limited vaccine available, but it's encouraging that there's a lot more that seems to be coming available. And if new products get approved, then that will certainly impact the availability of vaccine. With teachers right now, and we have to go with the way the state has prioritized how the vaccines to be administered. Now, any teachers who fit into the 1B category, who are 65 or older, or 16 to 64, who have underlying medical conditions, can get vaccinated right now. But it's just right now, those are the teachers that can get vaccinated, and school nurses were in their list. Their advisory committee at the state level are making those recommendations, and we anticipate they'll be defining who the 1C categories are very shortly.
And Dr. Huang, people again asking about your mask, so I'll just say that he's in an office space surrounded by other people in the command center at Fair Park, and that is why he is being protective and respectful of the people around him. Arlene Green is asking about the second dose. Can you get one dose from one location, one distribution point, and get the second dose at a different distribution point?
So the state, and we've talked to the state, we've talked to a lot of the area pharmacies and other people who have been providing those first doses. And the state has assured everyone that they are allocating second doses to everyone who administered a first dose. So the way it works, that's how we know we've got some vaccine and the second dose is available for the people who received their first doses. But the state has guaranteed that they will send those second doses to the people who gave out those first doses. So we are telling everyone, please go back to the place where you got your first vaccine, because they're getting that allocation for the second dose for those people. And so we get our allocation for the people who received the vaccine, the first dose from us. And we want to make sure that we have that second dose available for the people that we gave our first dose to. So that's what we're really telling people. They should, and everyone's on the same page. Please go back to the place where you received your first vaccine.
Very good. Will you be open on the weekends? Suzanne Jameson wants to know.
We have been. I saw some things that there's some concern about the weather again this upcoming weekend. I know we're following that right now with we're a drive-through site, so we're a little more susceptible to the weather. But I think we continue to monitor that each day, and we'll see if we're going to be able to be open this weekend.
This is a question from Brian Jennings, and I don't assume to know that this is actually true, but why is FEMA vaccinating their employees instead of underserved communities? I guess you could just take from that, what's the role of vaccinating the employees doing the vaccination versus the priority of vaccinating the public? So
one of the 1A categories for receiving vaccine has been workers that are involved in testing for COVID as well as administering vaccine. So that has been a group that's been defined to be in the 1A category, since the people are dealing with the people coming in for both testing and for vaccinations.
Let's do 3 more questions if we can. I'm David Schechter with Dr. Philip Huang, the Director of Dallas County Health and Human Services. We thank you for taking your time to talk to us. Sitting in a trailer at Fair Park, wearing a mask, he's surrounded by other people. Taking 3 more questions. Cynthia Andrade Chivatov says, so if someone is due for, she's just basically asking, how do you understand the rescheduling again? Is there a place where they can go to be like, I was supposed to do it last Thursday, but you were closed? The rescheduling, how do people figure that out?
Yeah, and again, it's been, we apologize, it's been so disrupted by the weather. We are posting it on the county website. We've tried to, one of the problems at Fair Park, the first several weeks, we were using paper-based systems, so didn't have all of the contact information to reach everyone and follow up. But what we told everyone was, you received a little paper card that had a date and come back on that date around the same time. Well, now with the disruption due to weather, we're trying to tell people, again, today we were seeing people that were due for their second dose on February 16th or before, tomorrow, February 18th or before, Friday, February 22nd or before, and come around the same time of day that you got your first shot. We're trying to post that and get it out to the media. We appreciate your getting the word out also, but again, the weather has even further complicated things, but maybe we'll be able
to drop that link in here into this conversation. Second to last question, Mila Misovia, are the people in the 17 zip codes that are being contacted for vaccines, are they minority groups or everyone who lives in those zip codes? So that's a good question. And also, how is it going catching up to potentially low income or disadvantaged communities that may have a little more difficulty getting to you?
Sure. Within those 17 zip codes, we're prioritizing. There are people who've been on the registration list who have signed up. So you do need to sign up. And then we've been trying to prioritize based on that vulnerability index, proximity index for persons within those zip codes. And so they are still 1As and 1Bs, primarily 1Bs, I guess, that we're doing of persons who live in those zip codes.
Okay, and our last question. Now that I said 400,000 people have been vaccinated roughly in Dallas County. What is the experience now with side effects, and what should people expect in terms of how they might feel, I guess, after the first and or second shot?
Sure. And a lot of people are having, some of these side effects even more after the second shot. But, some local redness, pain, just, achiness, some chills, some fever, perhaps, body aches, tiredness, those sorts of symptoms. But, usually goes away within a day. But that's a sign that your body is actually responding to that and that the vaccine is having an effect, which is a good thing. So it usually goes away within about a day or two. And but it does show that the vaccine is probably working.
Last comment is from Connie Urigas. She says, Dr. Huang, thank you, Dr. Huang, thank you for all your hard work and dedication to get Dallas safe again. It's not said enough.
Thank you.
Thank you so much for your time. We appreciated answering everyone's questions, and we'll see if we can, we'll drop in the link to the updated schedule here. We appreciate your time, and I assume you've got some more work to do. So thanks for being with us.
Thank you.